The first one, I am due an annual blood test for thyroid medication. Can I phone my GP and ask to delay the blood test, or will I have to go to the practice to collect my prescription? Actually, this is one for Maura. It's Maura GP's question. Will I have to go to the practice to collect my prescription, or will she fax it or email it to my local pharmacy?
Well, what we've been doing to date is everything has been done on the phone. The person should ring the GP. We usually organise a phone consultation. If it's just a matter of a repeat prescription, that's fine. There's actually a new system just been set up over the weekend that we can actually email the prescription straight through to the pharmacy, and so the pharmacy of their choice. So the blood test, that's a routine blood test. That can be delayed. And actually the labs are not accepting anything that's routine at the moment, for very good reason. So as long as the person is well, we would just say continue the same dose of medication as before, and we can organise all of that remotely.
Okay, and Killian, this question. My daughters are waiting for testing. They have both had symptoms and are now recovering. They're still in isolation. How long after recovery will the virus still be detected by the test?
Yes, that's a really good question. And the best data we have at the moment is probably out of China. So they found the virus was present for between 7 and 12 days after the onset of symptoms. So we appreciate that there has obviously been a delay in, I hesitate to say delay because it's a brand new service. So actually we don't know what the normal transit time is, but obviously people are waiting for a couple of days between having their sampling done and then the test being available. So what we're suggesting to our recommending to people is that they would self-isolate for 14 days from the onset of symptoms, and assuming that they have been afebrile or haven't had a temperature or fever for the last 5 days of that and the symptoms have completely resolved, then they would be considered to have recovered, if you like. So even in the absence of a test, that's what we're suggesting to people.
And would they still have the test?
So that's a really good question. I think if they're in the system and I suppose they have an appointment, then we would recommend that they turn up for that appointment, because the thing is there are two elements to it. One is obviously we want to try and identify whether they have been infected so we can contact trace the people with whom they may have been in contact. A negative test, even after 5 to 7 days, is quite useful to us from that perspective.
Okay, and Maura, I have MS and receive an immunosuppressive rituximab to treat my condition. I've been told that I'm at moderate risk of contracting the virus. I'm in relative good health, although I'm an ex-smoker, having stopped 3 years ago. My question relates to how my body would respond if I was to contract the virus. Given my immune system is compromised by my treatment, would I be at a disadvantage in fighting off the infection? I'm quite wary and at times fearful that infection would have very serious consequences.
Yeah, this person reflects an awful lot of other people's concerns at this stage. I think one point that's really important to make is that we're all at the same risk of contracting this virus because none of us have immunity to it. So that is why the social distancing or physical distancing is so important. However, the consequences of getting the virus is the other problem. And for somebody who is immunosuppressed, they may develop more severe symptoms. I don't know if there's a huge amount of evidence yet that correlates with this. We do know that people with hypertension or diabetes seem to have worse outcomes. But really, the risk of contracting the illness is the same for all of us. So the advice would be you socially distance yourself, you wash your hands, you do all the things that we keep saying to people, and keep yourself safe.
I suppose on a related question, Maura, can you ask if asthma puts somebody in a high-risk category or not too much? Myself and my two children are asthmatic. I've been hospitalised a few times in the last decade with exacerbated asthma and need steroids a couple of times a year, but when it's good, it's good. I'm in my 30s.
Okay, possibly. Asthma is a chronic lung condition, so obviously they tend to get more respiratory infections. Of course, people with asthma can get other viruses at the moment as well. We do see it seems to be that steroid medication, as in oral steroids, doesn't seem to help in this condition for the COVID-19, but it's often a standard treatment with regular asthma exacerbations. However, there is, I don't know what the figures are offhand, but there is so many people in Ireland who have mild asthma symptoms who really don't even take medication regularly. So those people, what I would suggest is take your medication, take your inhalers, look after yourself, but don't be overly concerned about it.
Okay. Killian, I see lots of family members out walking, says another listener. Couples, mothers and daughters, fathers and teenage sons, but all walking beside each other. Is it safe?
So if the family unit, I suppose, is living together and sort of isolating together, then they can walk probably within the 2 meters. What in essence what we're trying to do is restrict people's interactions with people outside of their immediate household. So yes, if I'm going to meet up with a friend of mine tonight for a walk, then we should stay 2 meters apart. But if I'm living with somebody, then I can go walking with them and can be walking side by side. But I think it was an interesting point made over the weekend by a number of observers that it's also important that we're cognizant of other people on the footpaths and on the streets. So if we are out walking, to try and ensure that we give them their distance as well, and that we're not crowding in on other people.
Single filing when you're coming
exactly
to meet people.
Yeah.
There's another one here from the same person, actually, Mary. I'm surprised that we're not encouraging social distancing in the home as much as possible, behaving as if we have it for these few weeks. Or am I being extreme, she wants to know.
It's a very valid question, but I think, yes, we've got to try and implement measures that are sustainable over a prolonged period of time. And I think if this was something that we were doing for, say, 2 days or 7 days, then physical distancing within the household may be applicable, but it will be very difficult to sustain for months on end.
Another one for you, Dr. De Gascon. Sean, last week on your show, the Minister for Health said we would be conducting 15,000 tests a day. I have heard of 2 people waiting a full week for a test. They've got appointments now for today. How many tests are we really doing every day?
So that's a really good question. And at the moment, we're probably somewhere in the region of 1,500 to 2,000 tests a day. So we are in the process of scaling up testing over the next 3 to 4 weeks. And it's important to explain to people that this is a brand new system. We weren't testing. It's a brand new test, and we never had a system like this before. Obviously, the majority of tests come through GPs, like more on the phone or through the hospital setting. And all of those links are electronic, and they have been set up over the last number of years. What we have done in the last 3 weeks, and really since in the last 2 weeks, is that we've implemented a third stream of testing where people go to their GP or through a telephone consult to get a referral from their GP through electronically. Then they go to a sampling centre. The sample is taken there and it comes to a laboratory for testing. So there's a huge amount of IT infrastructure and work that has gone in to try and make that as robust as possible. And yes, there are teething problems, and the capacity or the demand I think we saw after last weekend was probably somewhat unexpected, but at the same time we're working through that, and there will be a period of time before we get up to the necessary capacity. But I think just to put this in context from our own perspective in the laboratory setting, in an average influenza season we do about 15,000 samples over a 7-month period in the National Virus Reference Laboratory. And what we're trying to do now as a country is get to a situation where we're almost doing an influenza season in a day. So
yeah, it's a very heavy demand now. I suppose what people are wondering is, and you're going now to have, I think, 41 test points by tomorrow, I think is the intention. Yeah. We've the high profile ones we'll be hearing from Tallaght Stadium a little later in the programme. There's Croke Park, there's Páirc Uí Chaoimh, there's the ship down there on the docks in Dublin, and there's many other places as well. What about the labs where these then are being examined, where the samples go? There's your own, obviously, is the main one in UCD, but how many others, and what's the capacity of those?
So we've got about 10 or 11 hospital laboratories around the country that have started testing. Now, there have been significant global supply chain issues, incidentally, because I suppose this is a global pandemic in essence. So a lot of countries, a lot of laboratories around the country are using similar say platforms and similar reagents. So we're working with closely with the HSE and with the department to put in place a mechanism whereby the different labs will now start using different platforms, so those supply issues shouldn't be a problem. But broadly speaking, at the moment around those hospitals, we're in the region of, say, if we're at the NVRL, we're doing probably between 11 and 1,200 samples a day. The hospitals in around the rest of the country are probably getting up to around 1,000 a day. And what we're also going to do is, with support from the Department of Agriculture, Food and the Marine, is roll out other laboratory testing centres in the coming weeks.
Is there any point, though, in testing more people than you can actually get results for?
Yeah, that's a really good question. And I suppose from a public health perspective, we remain in the containment phase, so we want to try and identify as many cases as possible. But we do have to get the balance right between prioritising the sickest individuals, so obviously our key, and the reason we're keen to get so many hospitals testing is so that the patients who need to come in through an emergency room or need to be admitted to hospital, or indeed healthcare workers, can be tested quickly, and those results can be turned around in a short sort of 12, 24-hour time frame. In the community setting, it's, again, we may need to look at a situation whereby we can prioritise those people who are most at risk and most vulnerable. But the testing as much as we can to get an idea of the the spread of the virus in the community is really important, because again, at this stage, we don't have a vaccine, we don't have antivirals. So testing, isolation, contact tracing are still the primary means we have, and in addition to physical distancing, are the primary means we have of controlling this outbreak.
I know we had World Down Syndrome Day at the weekend on Saturday, Maura. Now, one listener says, I have an adult son in his mid-20s with Down syndrome. Would the virus be more difficult for him to fight off?
It's possible, because there is an inherent immunosuppression associated with Down syndrome, some Down syndrome people, and also some will have had underlying conditions, thyroid issues, heart conditions. However, if that man is well and is applying all the rules of physical distancing, they really should be okay. That applies to the entire world, of course. So it's hard to say. I don't think anybody should be overly concerned about their own particular risks at this time. What we all need to do is assume we could have it at any stage, and the person near us could have it at any stage, and therefore we need to actually work on that premise and therefore keep everybody else safe.
Another one for you, Maura. I'm a 62-year-old healthy male. Since Thursday last, I have been feeling lethargic and aching all over, but no sore throat or cough. Do you think I should self-isolate, or is it something I should not be too concerned with? This person also said, I'd like to take this opportunity to thank all in the front line battling this virus. They are our saviours. So what would you say to that man?
I would say absolutely, yes, self-isolate. There's no question of that. Possibly also ring your GP who'll go through symptoms with you, and you may well be put forward for testing. Our criteria the WHO have been saying test, and that's what we're trying to do. We're trying to get as much information as we possibly can. And while you're waiting for a test, if you have any question that you have any symptom that is respiratory in nature or flu-like, you should self-isolate.
Now, a question about asymptomatic people spreading the virus. I know about the 2 metres and how far the droplets spread when someone coughs. But what about people, Killian, what about people who are asymptomatic? How are they spreading the virus if they're not coughing or sneezing?
Yeah, that's a really good question. And again, if we look at the data set that came out of China, they reckon that genuine asymptomatic infection accounted for about maybe only 1.5% of those infections. So that's the majority of people will develop symptoms at some point during that pathway. The question is whether they, maybe in the day or two before they develop symptoms, if they're shedding virus, how can they transmit it? And in essence, it probably comes back to the idea of contact and hand hygiene. So if people have virus coming from their respiratory tract, so their nose and their mouth, if they're touching their nose and their mouth and then either shaking hands or touching surfaces and not keeping their own hands clean, that's probably how it is happening. But yet we expect that the majority of transmission with droplets is actually through coughing and sneezing, as you said, and maybe if people are breathing heavily for whatever reason, whether it's an exercise or that type of thing, if they're panting.
Yeah, and again, a similar type of question. What is the science behind this 2 metre rule, given that this virus is not airborne? Surely the advice should be to wear a mask to avoid transmitting the virus.
So the science behind the 2 metres in essence comes from droplet studies and how far they travel when people cough and sneeze. And as people will appreciate, obviously there's a gradient. So the very large droplets will fall very quickly and smaller droplets will travel a little bit further. Generally speaking, we think of droplets as travelling about around 1 metre. But because this is a new pathogen and because of the high case fatality rate initially reported, we are erring on the side of caution and advising people to stay at 2 metres apart insofar as is possible.
Yeah, lots of questions coming in still on 51551. I'm a grandmother to 8 small children, including 1 new baby. I am hands-on helping to mind them all. I am in my 60s. Many parents are still working. It's a dreadful dilemma. What would you say to that person? What would you say to that person we've just been hearing from, Maura?
Well, it is a real dilemma because childcare, especially childcare for people who are frontline, be it in medical or retail or any service, it's a big issue. However, somebody who in that age group will be considered as slightly more risk of complications of the virus if they get it. It's impossible to socially distance or physically distance in a situation where you're minding small children. And so that's a risk. And this is where maybe it comes down to there's personal decisions that have to be made. And if that person is minding the children, they probably should not be. They should be socially isolated and physically isolated from other people, and just stick with that particular role. And if they go home from that role, they would not should not be meeting other people in that situation. It's difficult. It's a really difficult situation. And we actually are finding an awful lot of people are calling the surgery about this kind of dilemma. And some people as well in a work situation asking, should I be certified from work? Should I self-isolate? My employer wants a cert. These aren't decisions we should be making for people. They're all individual decisions. And I think it's really important that people take personal responsibility and then also this huge kind of public responsibility for what they're doing. So some decisions can't be made on a medical basis. They should be made on a personal basis.
Dr. de Gascon, says a caller, Christine, we're in our 70s and we have no family. My husband has COPD, but I'm fairly well. However, I'm really afraid to go out shopping in case I bring the virus home to him. How can I keep him safe? I can't sleep with all the worry.
Again, it's a really good question. As Maura said, these are difficult decisions. I guess if she's trying to protect him, then she should try and minimise her external exposure. So it's a question of whether she does need to go to the shops, if she can get shopping delivered, that type of thing could reduce the risk. Because in essence, what we're concerned about in this situation is she will go out, acquire the virus somewhere, whether it's through contact or whether it's through somebody who is symptomatic. So in essence, she can still minimise risk by avoiding people who are obviously symptomatic, to retain her physical distance, and also to exercise really good hand hygiene herself, so that if she does go out to the shops, then she picks things up and then comes back to the house. First thing she does when she goes in is sort of wash her hands and make sure that she is sort of washing off the dirt and grime, if you like, of the outside world. But it is very challenging. Yes. I would recommend that she minimise her interaction with other people insofar, again, as is possible. But obviously there needs to be, if they've no family to provide sort of a conduit to the outside world, then they obviously need to have some interaction.
But there might be a neighbour who could do some shopping, or
absolutely,
a friend.
Yeah.
And I know, for instance, there's a lot of sports clubs are using their senior members to be available to volunteer to do this kind of thing.
Yeah, no, and that would be really helpful, because in essence we want to try and protect those who are at most risk, as Maura said.
Yeah, Maura.
Can I just say, Sean, yes, on that too, it was interesting. That poor lady said that she wasn't sleeping because of the anxiety that's been raised around this. And I think that is going to be an increasing problem with not just our older population, but everybody. There is such an amount of anxiety around this, and we should all try and help each other on that level as well. Mm-hmm. Everybody has the power to be able to speak and to discuss anxieties, and even just talking about it can actually allay fears sometimes.
Another one, Maura, you might like to take this, but feel free, Killian, at any stage to come in or mix and match, so to speak. I'm 28 weeks pregnant and a nurse on the front line. I'm still working on my ward, but not nursing any COVID-19 cases. In the UK, they have advised that women over 28 weeks pregnant can get a more severe case of the illness, so to really exercise social distancing and limit social contact totally. I'm wondering why Ireland hasn't advised this, and would it be better for me and my baby to be off work?
That's a difficult question. There really is very little evidence around pregnancy to date. There seems to be no what's called vertical transmission. Baby should be at no risk. However, ladies, when they're in the later stages of pregnancy, just because of the chest capacity is restricted sometimes due to your belly being in the way, can lead to more respiratory issues. I think the guidelines are changing on a daily basis. As far as I know, in Ireland, it's the same recommendations that you do not nurse any positive COVID-19 patients and possibly need to be redeployed into a different area after 28 weeks. But that needs to be discussed with your line manager, and I think...
Yeah, she's been told my redeployment options are to another ward and not working from an office, so my contact with people will still be the same.
Yeah, well, contact with people will, like I said, at any stage, any person we meet could potentially have this virus. So I can understand the difficulty for this person. However, I also understand the difficulty for the employer, and you can't have your workforce depleted because all pregnant women go home. It's a difficult one, and I can't answer it.
Now, this is one of these questions, I suppose, it's to the forefront of everybody's mind. I suspect there is no definite answer you can give, but in any event, I'll ask it. In the HSE or WHO planning for the future months, is there any rough criteria at which social distancing can be rolled back? I've heard a lot of people argue that as soon as any measures are reversed, then cases will spike again before we have a vaccine. Is there a serious prospect that these measures, Killian, will apply for the next 12 months or so?
So that's a really good question, and you're right. There's no definite answer. What we will be watching over the coming weeks and months is the number of cases, so our so-called epidemic curve, and in essence, when we get to a stage, if we can flatten that curve as people have been talking about and get to a situation where there's a very small number of new cases each day, or ideally no new cases each day, then you're right, we'll have to start thinking about potentially lifting the social distancing measures. But there is a risk because this is a new virus. We're not too sure how it's going to behave. So whether there will be another peak in the, say, for example, in the winter or something like that. So there may be a situation where at some point we will have to look at lifting the social distancing measures. But there will be the caveat that if the case numbers start to rise again, then they may well be implemented very quickly.
Can you get the virus a second time?
So there's no reason to believe at this point. So the short answer to that is probably yes at some point in time, but there's no reason to believe at this stage that there wouldn't be a short-lived period of immunity. We would expect that probably at this point, although we don't have an awful lot of evidence, that it will probably be like the other coronaviruses, so probably 3 to 6 months. And another analogy would be the influenza virus, where we get another vaccine every year because the virus has changed a little bit. So if this virus sort of does evolve over the coming years, then it's quite likely that reinfections will occur. But at the moment, we've no reason to believe that people are going to be reinfected within a short period of time.
Now, this is a question about a carer coming into a home. I live with my mother who's in her 90s. A carer comes to her every day. She showers her and prepares her breakfast. The carer wears gloves when attending to my mother. I understand that the virus can live on clothes for some time should the carer wear a gown. I understand that the demand for PPE, that's personal protection equipment, is great, and it may not be possible for the company contracted by the HSE to source it during the crisis. I was thinking of making a gown for the carer and washing it in hot water after use every day. Please ask your experts if this is necessary. What do you say to that person, Maura?
I would think that's a very sensible idea, that using their own initiative. A house coat, an old piece of clothing that could be worn and washed in hot water, so that the next day it would be put on again and it would be another barrier. As long as the carer the carers provide such an essential part of help at times, at all times, particularly now. As long as a person is being very careful about hand hygiene and possibly wears a mask in case they have any symptoms themselves. Also, if they are in any way symptomatic, should stay away. In that situation, another carer would have to be brought in. But the idea of having your own gown in the house would be a very sensible one.
Last quick one to you, Killian. I was at a meeting on Tuesday the 10th, mostly with older people. I just found out that a person who was there has been diagnosed in hospital with COVID-19. I'm feeling fine myself. Don't want to bother my GP. Should I ask for a test? It's now 13 days since the meeting.
Okay, so if you're otherwise well and have no symptoms yourself, then there's no need to. And equally, what's key in the context of that individual is whether they were symptomatic at the time that you would have had the interaction with them. So if you're well at this point in time, and equally if you haven't been contacted by public health, then you have nothing to worry about.
So many questions, so many uncertainties. We didn't get to anything like all of them, but look, thank you so much indeed for coming to studio. Killian de Gascon, medical virologist and director of UCD's National Virus Reference Laboratory, and Maura Finn, GP, on the line there from Ennis in County Clare. We'll take a break.